Dr. Shyam Sundar, radiation oncologist, precision oncology clinic. Today we will be discussing about endometrial carcinoma. Endometrial carcinoma is the cancer which is originating from the body of the uterus, which is present in the upper part of the uterus. And the disease coming from the lower part of the uterus, that is the cervix, is called as a cervical cancer. Now coming to only the endometrial cancer today. So usually this endometrial cancer is the disease found in elderly females, usually in postmenopausal period. So the most common symptom in this endometrial cancer is usually postmenopausal females come with complaints of spotting or occasionally bleeding PV. Very rarely do they have pain abdomen or anything. Most commonly, the endometrial cancer is also picked up on routine ultrasound when they do it to see the endometrial thickness. So once if you are symptomatic, then the patient usually goes to the gynecologist for the initial evaluation. So after the gynecologist sees, usually they will refer her to get an ultrasound done. So the ultrasound pelvis is usually done. So once we do the ultrasound pelvis, most commonly what we see is there is a lesion in the endometrium or in the inside of the uterus. However, most often what happens, there will not be a lesion as such, but there will be thickening of the endometrium. So based on how thick the endometrium is, the gynecologist will take a call whether a biopsy is warranted or not. If a biopsy is warranted, then the gynecologist goes into the uterus and takes a small piece for biopsy. Biopsy is the confirmatory test for endometrial carcinoma. Once the histopathology or the biopsy confirms it as an endometrial carcinoma, then the complete staging evaluation will start. So the staging evaluation will include either a PET-CT or an MRI to see where the disease is extending, whether it is localized only to the uterus and where in the uterus it is there and how and to what depth has it penetrated, or if the disease has gone out of the uterus. Most often endometrial carcinoma, the disease is localized to the uterus and it is operable. So if the disease is operable, then the treatment of choice is going for a surgery. Here again, the surgeon, either a gynecologist or a surgical oncologist, will decide whether to do a simple hysterectomy or a radical hysterectomy. Simple hysterectomy in the sense only the uterus will be removed. However, in radical hysterectomy, the uterus, the lymph nodes, and all the surrounding tissue will be removed. Radical hysterectomy is a little extensive surgical procedure. So how does the surgeon decide which one to go? So usually the pre-staging workup, they will get an idea whether it is a very early stage tumor or it is an advanced stage. So if the surgeon is very confident based on the imaging that it's a very early stage tumor, then they will go for a simple hysterectomy. If not, more often than not, then they don't want to take a chance, they'll go for the extensive surgery. Once the surgery is done, the entire specimen will be sent to the examination and we get a histopathology report, which will be the final report which says that where and all the disease has spread. So based on this, the patients will be staged, stage 1, stage 2, stage 3, etc. So based on the stage and the age of the patient, the grade of the tumor and other histopathological qualities of the tumor, we grade the patients into low risk, intermediate risk and high risk. These low risk patients are again divided into low intermediate risk and high intermediate risk. So based on the histopathology of the specimen, the age of the patient, we categorize the patients into 4 categories. Number 1 will be low risk. Number 2 will be low intermediate risk. The third will be high intermediate risk. And the fourth will be high risk. The risk in the sense, the low risk means it has the least risk of the disease coming back, and high risk is these patients have the highest risk of disease coming back. So based on this, we will decide what next treatment has to be done. Most often, if it is low risk with no other features of any high risk, then no further treatment will be warranted and these patients will be kept on. However, this decision has to be done by a qualified oncologist. If it is intermediate risk, here again it is low intermediate and high intermediate. If it's a low intermediate risk, then probably the patient will require radiation. Either it can be only vaginal brachytherapy or the patient will require extended external beam radiation followed by brachy, which will be about 4 to 6 weeks of treatment. However, if it is only brachytherapy, it will be 3 sessions of brachytherapy. This again will be decided by the stage and grade of the disease. If it is high intermediate, here the patients will require both radiation and chemotherapy. This radiation and chemotherapy can be given in different ways. Either chemo and radiation can be given together, that is called concurrent chemo radiation, or one can be given first followed by the another. Either you can give chemo first and then radiation, or radiation followed by chemo, depending again on the characteristics of the tumor. The last category, that is the high risk, is where compulsorily the patient will require both radiation and chemotherapy. And this will be a more intensive form of treatment because the risk of recurrence is highest here. However, all said this, endometrial carcinomas usually respond well when operated and treated adequately with whatever radiation or chemo, whatever is recommended. However, what we see is if we pick up the patients earlier and treat them, then they tend to do very much better. So, in this context, I think early diagnosis, early treatment will help the patient. Hence, what we suggest to most of our patients is don't wait for the symptoms to become aggravated. Whenever an elderly woman, especially a postmenopausal woman, has spotting or bleeding, don't take it lightly. Kindly consult a gynecologist and get a ultrasound, which is a very simple investigation. Just a simple ultrasound abdomen and pelvis will help us diagnose this condition very early. Thank you.